Hello, I'm Lindsay Peterson from Washington University, and I'm here with Dr. Ann May, and we are here to talk about the EFFECT trial. So Dr. May, first of all, congratulations on conducting this trial. Not an easy trial to conduct and complete, and congratulations on the podium presentation. We love to see these types of trials out there getting attention at SABCS. So first of all, tell us a little bit about the trial and the challenges that you experienced while conducting the trial.
Actually, this is a very interesting question because I would say this was one of the most easiest trials I have performed so far. So we experienced that patients with metastatic breast cancer were very motivated to participate. So it was the first time that patients emailed me that they want to participate and that we were not searching for patients to participate in our exercise trials. So that was a very nice experience, and I think that made the trial, the recruitment easy. But the challenge we had, of course, was the COVID-19 pandemic, because we started recruitment in January 2020. And as we all know, from March onwards, there was the pandemic. But still, it was possible to run the trial, and patients were willing to come to the centers for the training, even during the pandemic.
That's amazing. I think that really speaks to the importance of these trials, that patients really do look to us to provide these opportunities for different lifestyle interventions. And the fact that even in the metastatic setting where patients are facing different challenges, these are still trials that they seek out and want to participate in.
Yes.
So, one of the things that I thought was really impressive was the patient-reported outcome data in terms of fatigue and quality of life. And there's lots of studies that have shown that patient-reported outcomes correlate with progression-free and even overall survival. Obviously, this study was looking primarily at these PROs, but will you have any data on PFS, even if it's just hypothesis generating for the future?
Yes, of course. So this is indeed an explorative outcome of our study. So we will look into PFS, but also survival in the coming years. So yes.
Wonderful, wonderful. I think that one of the challenges we face with these trials as opposed to pharmaceutical trials is the focus on biomarker outcomes and PROs, and we don't always have those clinical outcomes that we see in pharmaceutical trials. So anytime that we can get those for lifestyle intervention trials, it's a big win. So speaking of biomarkers, I know you collected quite a few in this study. Can you tell us a little bit about what you collected and what you expect to find?
So what we collected blood samples at baseline, 3 months and 6 months, and they are now in the biobank. And currently we are investigating the inflammatory status of our patients, because we think that this is one of the potential mechanisms how exercise works to reduce, for example, fatigue.
Wonderful. And then any words of wisdom for either patients in terms of what they should be looking to do for exercise, for providers to find time and to discuss this topic with patients, and perhaps how they should approach this topic with patients, and finally for researchers in this field in terms of what they should be looking at in their studies to really move the field forward?
Yeah, so I think that my advice to patients is to ask their healthcare providers about exercise, because that will help to get it also in clinical practice. It's also important to talk to the nurse or the treating physician about whether exercise is feasible for the patients, and then look for an oncology-trained physical trainer. For healthcare providers, we know that the time is a limiting factor, but we also know that the right code is one of the most powerful things to get patients exercise. So please, healthcare providers, recommend exercise to your patients. And perhaps it's good to look in your center whether you can find someone, for example, a nurse or a lifestyle coach, where you can send your patients to, and then they can get more detailed information about their exercise program. And then your last question was about the researchers. So what should we do? So I think that it's important to have large trials like ours and not do only small trials, because if you really want to change the field of exercise oncology, we need to do large randomized trials, multi-center, multinational. So I think that what we did in EFFECT was successful because we did that in all these countries in Europe and in Australia. So I'm happy to participate with everyone who wants, because I think that will move our field forward.
Absolutely. I couldn't agree more. And again, congratulations on such a well-conducted study and really great outcomes.
Thank you, and thank you for talking.
Absolutely.